Hello and welcome to another edition of 41 Files. I'm really happy about the fact that we no longer have to say what number of 41 File we're on. I've lost count. We've all lost count. Sam probably knows.
It's in the 60s.
In the 60s. Like all great things, it's in the 60s. Sam Hartle, digital producer, alongside me, Taylor Hemness here for 41 Files. Hi, Sam.
Yeah, it's good to be back. For those who followed me on social media, I took a cross-country train trip, and it was a lot of fun. Highly recommend.
And worth going back on his social media and seeing all the stuff that he did, too. A lot of fun doing that. And for the first time in the 41 Files podcast studio, 41 Action News investigative reporter Jessica McMaster, Emmy Award-winning, multiple award-winning investigative reporter Jessica McMaster. So glad to have you in studio with us today.
I am, too. Thank you for not blocking me anymore. I appreciate being here.
Were we blocking her?
I'm surprised we haven't had her on yet, given her desire to talk about things that
Absolutely
are important and just talk about things.
Absolutely. And we also have a special guest in studio with us today, and that's Amy Roberts, who is with the Kansas City, Missouri Health Department. And Amy, I know part of your title is lead poisoning prevention, but you gave me a 2-business card long title. I want to give you a chance to give your full title with the Kansas City, Missouri Health Department.
Sure, thank you. I appreciate it. So I am the program manager for the Kansas City, Missouri Health Department Childhood Lead Poisoning Prevention and Healthy Homes Program.
Now, see, that's why it was better for you to do it and not for me to do it.
Thank you.
So we're talking today about a story that Jessica had on the air on 41 Action News a couple of days ago, earlier this week, actually, about a certain area of Kansas City, 10 zip codes specifically is what you mentioned there in your story. If you haven't seen it yet, it's on our website, kshb.com, where kids are being tested for lead poisoning and are more susceptible potentially, or at least showing a higher rate in those particular 10 zip codes. Tell me about your story and kind of the reporting that got you to where you learned about it to where you got it on the air.
So when we started looking into this, like most things that we discover through records and documentation, we didn't know that there was kind of this little high-risk cluster, but we did know that lead was a problem. It's been reported on before, and it's really a problem everywhere, which is why children get tested. My 1-year-old son just got his test that both of my kids have gotten each year. So we put in a records request with the health department just to see how many kids in Kansas City this year and in previous years. Actually, I stand corrected. It was not 2019. I don't think we have that data yet. 2018 in the few years prior to that, were testing positive for lead. And we asked to see the zip codes, to see the percentage of kids who were testing positive. And when they sent us, the health department sent us this great map where I think you were either in the white, which few zip codes are. That means that they have no cases. Or you were kind of this lighter orange, or you were bright orange. And we noticed these 10 zip codes where kids are at high risk, where they're in the bright orange, were all connected. They were all together. So that made us curious as to why. Why is that happening? And that's where the health department was really able to help us piece that together.
And that map you showed in your story, that map that's in your story on kshb.com right now, that's what you got from the health department. That we didn't color that map. That was what we got from the health department, right?
We did not color that. No,
Yeah.
They gave that to us.
What lines were you able to draw through your reporting about what connects these 10 counties? What are you able to say after you've done your story definitively about this topic?
So as I understand it, it primarily comes from old housing. And so we're looking at lead-based paint that predates the 1978 lead paint ban. And a lot of people don't realize it's there because, like the health department will tell you, friction from closing windows, closing doors, and the door frames kind of creates this very fine powder. And it settles in as general house dust. And so nobody really realizes it's there. And so especially kids who are crawling, they're getting it on their hands. Like the health department told us, they're standing up at the window and then they're walking through the house. They're putting their fingers in their mouth and then they're ingesting it.
Amy, I want to turn to you now because obviously you played a large part in the story and sharing some information about the problem itself. Do you feel like this is something that people are aware of? I guess that's the best way to ask that question. Do you feel like this is something that, because the person that Jessica spoke to in the story, the woman there in the story talked about that she was not aware this was going on. She had no idea because it's colorless, odorless, that kind of thing, what Jessica was just mentioning. How do you feel like people are on an awareness level about the potential deadly or the potential threats of lead poisoning?
There are a lot of people who are not aware that it's still a problem. A lot of people have heard about it before and heard about the issue before, but they think, that's back from the 70s and back in the day. They had some public awareness campaigns back in the 70s and even prior to that. But a lot of people feel like, oh, well, that's just, that's something of the past. They don't have that anymore. That's a health issue that's no longer an issue. But we know that all of the lead paint that was ever painted on houses is still there.
Right.
People don't usually totally scrape their house when they maintain it. They usually just paint over it. So that's the biggest thing with lead paint. So we know if the house was built before 1978, there's a good chance it has lead paint that's just been covered up.
Sure. The thing that surprised me most as a dad, because I have young children, the thing that surprised me most about Jessica's story was when you used that irreversible word, talking about some of the effects that can happen whenever lead poisoning is apparent in a child. First, tell me more about some of the things that can happen when it comes to lead poisoning and the kind of effects it can have on a child, and then delving more into that irreversible factor a little bit there.
Well, lead affects all body systems, and once it gets into your body, a lot of it will stay in the person's body for their whole life, and it can kind of come back and cause problems at different times in a person's lifespan.
Sure.
So, but what we see a lot of times is kidney problems, problems with vision, problems with speech. There's a relationship with attention deficit disorder, attention deficit hyperactivity disorder. There are nervous problems in the nerves in the hands and feet. We'll see stomach problems, problems with strength in a person's bones, balance problems. Usually the ones that we see most frequently are problems with speech and development and brain function in kids.
So I was listening to a podcast from WNYC last week, actually, about lead poisoning. And I learned, I previously didn't know this, we talk about kids who ingest sometimes paint chips and stuff like that. And it's weird. Why would kids eat paint? But I guess lead paint has a sweetness or a characteristic that actually the kids they come back to. And that makes, and I think in some cases where you're talking about the lead is not actually removed, it's just painted over, makes that challenge of getting lead out of a house even more difficult.
Right. A lot of times that paint, the multiple thickness of paint that the peels off around windows and doors and porches, they're really thick paint chips that are kind of square. And kids who tend to put things in their mouth as part of their development will kind of develop an affinity for that taste, that's kind of a sweet taste. And those might be the kids that also put other things in their mouth, like frequently toys, or maybe they suck their thumb, or they eat dirt, and then they would be a child that might put paint chips in their mouth. But again, the biggest source of exposure is that invisible dust. That's contaminated house dust.
And that was the second part of your reporting, Jessica, the next morning, because your story aired on an evening newscast. The next morning for 41 Action News Today, you had a second portion talking about toys that may, toy cars and that kind of thing that may have the same kind of issue as the actual house paint
Those
does.
Matchbox cars, because when we walked in, and Amy will tell you, I was shocked. When we go to Tim's parents back in Michigan, that's my husband, Tim, they have all of their old Matchbox cars.
Yeah.
And the kids
Decades old.
are always putting them in their mouth. And Amy reminded me those are not for 3-year-olds and younger. So we've been acting badly. But they chew on them. And I have to imagine, I haven't looked at them, but I will the next time I go home. I would bet that there's paint that's been chipped off. And, Amy will tell you, you either put them away or throw them away. So... there was other things that I think you mentioned too. She had some pottery, even some pottery that said that it right on there does not contain lead, had tested positive with the health department.
Right.
Makeup. What were some of the other things? I think it mostly comes from homes, but those are just little household things that
Sure,
you have to
things
look out
that you've
for.
got around your house more than likely. What kind of responses since our story aired, have you gotten calls from the health department saying, hey, I saw this story, I need to do something? What kind of response have you seen from this?
We have had a couple calls for more information, also some calls about getting their kids tested,
Sure.
which is always important. We've had a couple calls about our home repair program, which is great because we have the funding to help people fix their homes in rental homes and owner-occupied homes. So now's the time for people to apply for that too.
One of the things, I'm sorry, I didn't know you were going to talk, Sam, but one of the things I didn't get to in the piece, because, we only have so much time, that Amy mentioned to me last time that I wanted to make sure I brought up here was diet. Because she explained to me, and maybe you can explain it to them how that works. She was actually saying, with certain foods, some of that lead can be filtered out.
Right.
You mentioned the WIC program and how they are, I don't know, high in potassium or foods that are rich in, I don't want to mess up.
No. Calcium, iron, and vitamin C are the foods that will help compete with lead absorption.
Help your body, you mean?
Right. And they help for people to be healthier in general. But foods that are high in calcium, iron, and vitamin C will compete with the lead that gets into a child's body and hopefully help them not absorb as much as they otherwise would.
Right.
Because that's part of it too. She was saying younger children do they have less absorption? They don't absorb as much, or they absorb too much?
Kids absorb more than adults.
And that's the problem, because we noticed, and I asked her, at a certain age, you don't see as many kids testing positive for lead. And a lot of that had to do with the absorption. So the diet was something I wanted to make sure people were aware of, that their kids were eating those nutrient-rich foods, and that can help combat some of that lead.
So going back to the programs that you guys offer at the health department, I was on the website this morning, and I think the home program, I think as of October last year, you guys had done nearly 500 homes from the list that I saw. The question that I have, and it might be relevant to some of our listeners, is if I live in a renter, if I rent from a property, it's kind of incumbent upon the owner or the landlord to be the one that removes that lead or takes the lead abatement steps. What rights or programs, if I'm a renter, do I have? If I'm a mom and my kid tests positive and I rent from a home that has lead in it, it's up to the landlord to get rid of that. Do you guys run into any situations where landlords aren't acting as quickly enough to get that? And what resources does that parent have, that family have, to get their kid out of that situation?
Well, that's a great question. We do provide lead removal through our Lead Safe KC grant to rental property owners. We do have tenants that will pick up an application and then give it to the owner, or they'll even say, fill it out for the owner and then just have the owner sign it. We do need additional documentation for those applications. But the other thing, we do provide education and resources for tenants so that they can help keep their home as hazard-free as they can. The other thing we do is if the child is lead poisoned, we can have an inspector and nurses. They will come to the house and go through the house with the family member and talk about, or the tenant, and talk about, these might be some hazards. Here's some hazards. This is what you can do to decrease your risk, decrease the risk of your for your family. And then we also have an enforcement capacity. So when we work with the property owners, if we have a child who's lead poisoned and they have an inspection from a licensed inspector from our program, then we guide them and they have to come up with a plan and make those repairs.
The landlord, right?
Yes, that is right.
The property owner does. I have a couple of questions about the reaction part. The first bit about the ability to help people with the lead removal from their home, because I was curious about, and Jessica described that in the story, that being something people can apply to do. You were just mentioning there. What does that process look like? What is it like? Say, okay, I've got lead in my home. I need some help getting it out. What happens then if you have someone that's able to do that?
Well, people can fill out an application, and we will send their information to the agencies that kind of review the historical issues that could be in the property. We have an inspector that comes and checks to see where the hazards are. In addition to lead paint hazards, we also provide an inspection and some free repairs of other issues in the home that can affect a person's health. So trip and fall hazards, or gas leaks, carbon monoxide leaks, asthma triggers, some of those things in addition to the lead. So we have two inspectors that go to the house, look for what the issues are, write it up, and then we have contractors who are licensed who will come and do the work.
And that was featured in Jessica's story because the person you spoke to there talked about that she had, siding put on her home and the paint removed and new doors, new windows, that kind of thing. That's all part of the process, right, of having the lead removed, that factor being removed from the home?
Right, and the type of work depends on what the hazards are. So not everybody gets siding, but it depends on where the lead paint is.
Okay.
So if the lead paint is in the windows, then we will replace the windows. If it's on the full exterior, they may get some siding. If it's on a porch, we may do painting. If it's in the soil, we may do landscaping. So it's how it relates to the hazard.
And then the other part is with the children themselves. If there's a child that is determined to be lead poison in one of those situations. What's next for that child? What's next for the parents as they take their child to be tested and get a positive confirmation of that? What does that look like moving forward for the health of the child?
Well, if we're working on the house, if the child is lead poisoned or has been exposed, then that will elevate their priority in terms of when they get their house fixed. It still takes a number of months because it's a complicated process. But we also have resources we can provide to the family in terms of some teaching and then some supplies in terms of, oh, here's some cleaning supplies. We can help you, show you where you can clean and get rid of some of the hazards. Here's where you can paint temporarily, some temporary fixes to help keep the kids safe. In addition, children with lead poisoning may qualify for a nurse home visit, or the parents can request a courtesy visit, and a nurse and inspector can come to the house and help talk with the family and provide teaching.
Jessica, you mentioned in your story there about what parents should do as far as testing and that kind of thing and making sure your kids are being tested on a regular basis. I guess the first part of this question is, if I live in a home that was built past that 1978 ban, I should be less concerned or not concerned? What is your feeling on that about what my level of concern? I mean, obviously I'm still going to test my kids, but what should be my level of concern if I live in a quote unquote newer home?
If you live in a newer home, I don't think there is much concern, is there, Amy? I mean, in terms of, because you wouldn't have
Right.
the lead-based paint.
Right.
So I think it's recommended that children be tested between the ages of 1 and 2.
Okay.
Just once. And then if they are at risk, if you live in an older home or have any other reason to think that they should be tested, then you're supposed to do it every year, is what,
Okay.
Amy, I believe what you told me, if you're in a high-risk area.
Right, for people who are in high-risk areas. But it kind of depends. Sometimes, for example, if the property has been used for something else before, if it's a warehouse that has been remodeled, there may be some traces of lead from prior usage. If it's a house that's been built on an area where there was a farmhouse or barns that could have had lead paint on them, then that is potential contamination in the soil. The other thing is that even though the biggest risk to kids is lead paint, we do see some issues in children that live in newer homes. For example, we had a child who was an infant with a high blood test result. And when our inspectors went to the house, the contamination turned out to be not from the house, but from the work of the parents. So the dad worked at a printing company, and he had brought lead dust home on his shoes and on his
Wow.
clothes, and the baby had been exposed that way. And this was a baby that was too young to be really walking around and getting into the dirt,
Right.
Sure.
things like that. So we knew that there was something unusual. And so we ended up looking at the person's work and getting some other agencies involved and helping work with some of the hospitals and medical providers and some of the state and federal agencies to identify the hazards in that person's workplace. So they really had to make some changes to protect all the people at that workplace.
Well, I think that goes back to, if you look at the map that we were talking about earlier, although there was a cluster of kind of an older portion of the city, there were zip codes south of the river, north of the river, that had kids that tested, percentage of kids that tested it. It's really kind of a widespread problem.
Right.
Right. It is a widespread problem. And again, we do have a lot of cases in the areas where the high risk pre-1978 deteriorated housing is. But definitely take home lead from people's parents' work can be an issue. And then also, if kids go to a daycare somewhere, like a family member or a home daycare that's in a residence, or even if it's just an old building, or again, a converted building, there may need to be some investigation on potential sources in those areas.
And that makes sense. I mean, they're there all day. My kids are
Sure.
in school right now for 8 hours. So
I think that's interesting too, because there's so many of the stories that we tell on the news on a regular basis that if we don't craft them carefully and if they're interpreted a little bit wrong, it would feel like we're trying to scare people. And that's not, it doesn't feel like what this is, but it feels like people need to be maybe more aware of this than they are, because that what you just said there about a parent bringing home lead dust because of their occupation, I think is not something that a lot of people wouldn't necessarily consider, that when they're coming home and daughter or son runs up to hug them whenever they walk in the door, they may be giving them something that they aren't aware of. And I think that's something that just it isn't about scaring people. It's about making people more aware of what they need to do to watch for this kind of thing.
Right, and the important things are that it's usually not super expensive. It's an issue that can be addressed, and it doesn't always cost a whole bunch of money, and it doesn't mean people have to move, and it doesn't mean people have to go to extremes. A lot of times, there's simple measures that people can take.
Painting over old paint is one of them.
Exactly. Yes, exactly.
Well, again, there are ways that the people that, if they live in one of those zip codes that you mentioned there, if they know that their home is possibly one of the things, they can contact the health department. You said there are forms that people can fill out and try to be, because you're trying to help people on a regular basis. I think you said in the story, like 70 families or something like that in the next little while you're trying to help. There's ways for people to get help.
Right. We fix around 70 homes a year.
Okay.
And again, we are always taking applications, so people can apply, and that would be awesome. We also provide free blood lead testing for kids and pregnant moms, and they can make an appointment and come in and get tested anytime. We have a number of events in the community where we are doing outreach, so we'll do presentations, and we have one coming up this month, actually, at the City Market, where we're working with the National Public Health Service, and they're doing some soil testing for free, so testing people's yards and garden for contaminants. And then we're also doing free blood testing and testing products. So if people have spices or jewelry or pottery, they can come and bring it, and we'll test it for free, and then they can be aware.
Spices, that was the other thing you were thinking about.
Yes, it surprised me when she had.
It surprised me when you
paprika
had it in your
sitting there.
story. That was the other thing that surprised me in your story.
Is there a specific spice?
Bulk spices is what you had said.
when you
correct?
buy them in bulk, right?
Okay, all right.
Right. Usually bulk spices or unmarked spices. We recommend people buy spices from a regular grocery store. You just have to be careful with spices that you buy in bulk. It doesn't mean you have to completely trash all of your spices if you buy all of them in
Right.
bulk, but people just need to take care.
Someone listening to this while looking at their 10-pound, jar of paprika sitting over on the counter. We're not telling you to throw
Who
that
needs
away.
that much paprika
I'm telling
anyway?
you, there's some paprika fans out there.
Paprika is one of the ones that we look at frequently.
Wow. So there's a website, though, that people can go and maybe make these appointments you were talking about. Can they go to the health department website to do that?
They can find our contact information on the website.
Okay.
And they can call 816-513-6048. And they can make an appointment or get an application, request an application.
Perfect.
Real
they-
quick too before. Oh, I'm sorry.
No,
No,
please.
sorry. They can walk into the health department and we can give them an application, and then they
Both
can.
for the home or to get their kids tested, all that kind of stuff.
Exactly.
Good.
And then do you guys have? You showed me those little kits. Where you can wipe along door frames and windows. Can they get those from the health department? Because I did go to Home Depot and all I could find was those little scrub brushes that you had.
The swabs. And the swabs are sometimes a little easier to find, but you can get any home test kit either online or from one of the big box stores or like Westlake Hardware and some of those places. We have some home test kits that we provide to families, but typically those are families who have a lead poisoned child and they don't qualify for our programs or they don't qualify for an inspection. And so we like to keep those for families that are have a lead exposure in their house.
And want to know, and they want to know about it. Sure.
Right, right. Or if it's perhaps a daycare that's doing remodeling and then they have a high need.
Right.
So I wish we had more of those test kits and
Sure.
could just give them out.
Well, it's good for them to know that they're there. Get on Amazon or wherever, you wipe it, send it in a test tube, and your test results come back maybe while they're waiting with the health department to see if they qualify for a program. So
Right, exactly.
Okay. Well, Amy, thank you so much for being on today. Thank you for being in Jessica's story and for talking to us today. We really appreciate it.
Thanks so much for having me.
And Jessica, excellent story.
we have one more question.
You have one more thing you want to ask, please.
What is the worst case you've seen in terms of the lead poisoning? You got a story behind it, aside, you had the great story about the dad bringing home
Yeah.
from the print company.
Right. Well, we see a lot of different families with a lot of different needs. And a lot of time lead poisoning comes from a deteriorating housing. And so families have lots of different needs. And so, for example, we were helping a family who had lead poisoned kids. They had more than one child in their home with lead poisoning. And when the nurses went to their home with the inspectors to do the investigation, one of the things we talk about is cleaning and trying to clean up some of that dust and some of the chips. And the family didn't have running water at the time. They had a an issue with a sewage pipe. So we were able to work with that family, and they were able to get their water issue repaired. But they had been without water for almost 2.5 years, and they had been going next door to their grandma's house and carrying water over in buckets. And so they were flushing their toilet with buckets and bathing with buckets. And we see a lot of families that don't have water or access to water. And in addition, that family needed to put a fence for their dogs, so they needed to kind of work on their backyard, and we needed for the dogs to be away while they were working on their house, right? So they were able to get some resources where they could put a fence in their backyard and secure their dogs and get their water turned back on. And they had a lot of issues in their house in terms of their flooring being uneven, and they hadn't been able to clean for quite a while because of not having running water. So when we were able to go in, we were really able to help them with cleaning issues and getting rid of their hazards. And then they had some safety issues with unsecured weapons that we talked to them about, kind of how to protect their kids and protect their family, and looked at a lot of different issues in the house. So we were happy that we were really able to provide kind of a comprehensive services for that family.
Wow.
That's great.
It's a lot. I mean, it's a lot for one department to have to handle too.
Yeah, it's great that you go in there for lead. But I imagine
Sure.
you probably see stuff like that a lot, where you go in and you're able to help connect them with other resources, because there's probably a lot of other things, like you said, that are kind of sometimes in disarray.
Right. And there's a lot of programs that at the health department that go into people's houses. And a lot of times we see a lot of different issues. And so it's sometimes a matter of finding all those services within our health department, and then also within the community, that we can help families in a lot of different ways.
Good.
Well, once again, we want to thank Amy for being here. Amy Roberts, thank you so much for being here and kind of putting a lot more into this, because there's, the problem with the news, as Jessica mentioned, is sometimes we don't have 30 minutes to tell a story, and we're so glad to be able to hear more about this, because it's a topic that any family, especially with young children, would want to learn more about. So, Amy, thank you for being here today.
Thanks so much. I appreciate it.
And Jessica, excellent reporting. Thank you for taking time out to hang out with us in 41 Files.
Thank you for finally inviting me.
Sam, what do we think? 6 months we'll have her on again? Something like that?
I think that sounds okay.
6 months sounds great.
Okay.
All right.
See you in a year.
Thanks for joining us for 41 Files.